For many patients, the idea of a loved one donating a kidney to them brings mixed emotions. There is gratitude and hope, and of course, but also worry. Will my donor be okay? What if something bad happens to them because they tried to help me? These are concerns that are completely natural. In fact, as a nephrologist, I've seen many patients initially refuse offers from potential donors because they were afraid of the risk to that person. So how safe is living kidney donation? The answer is based on decades of data. And living donation is very safe for the donor overall, but it's not zero risk. So let's break it down into short-term and long-term risks. I'll share some inspiring stories of donors, including 2 kidney doctors who have become donor themselves. So first and foremost, nobody can be a donor without passing a very thorough medical evaluation. We do this to ensure that donor is in excellent health. And after donating that kidney, there is no harm to them in foreseeable future. When someone steps up to donate, they undergo numerous tests, detailed blood work, urine test, imaging of their kidneys, CT scan to look at their kidney anatomy and health, and assessment of their heart and overall fitness. They also meet with an independent donor physician and a social worker to ensure that they're mentally and emotionally prepared and not under any pressure. The principle is first, do no harm, especially to our donor. If we find anything that suggests even a mild risk to the donor, we will not proceed. Now, kidney removal is done through a laparoscopic surgery. Small incisions, takes 3 to 4 hours under general anesthesia, and hospital stays 2 to 3 days long. They're walking the next day. Full recovery is in 6 to 8 weeks. The remaining kidney grows and adapts. Most donors have normal kidney function and live healthy and active lives. So short-term risks, like any surgery, there are risks of bleeding, infection, like urinary tract infection, pneumonia, blood clots. These are possible, not very common. There is also a small risk of an allergic reaction to anesthesia, and some people may experience pain or infection at the incision site, which is manageable. As with all surgeries, there is a very small risk of death with kidney donation, approximately about 3 in 10,000. Now, to put this into perspective, the risk of death during normal labor and childbirth in Canada is roughly around 1 to 2 in 10,000. So while these risks are real, they remain extremely low, and major complications are very rare. And in terms of long-term risks, most donors live as long and as equally healthy as non-donors. A few may develop blood pressure or mild protein in the urine years later, and this is because the single kidney is doing extra work. So it's filtering a lot of blood, and this is called hyperfiltration that can cause protein leakage and usually manageable. Fewer than 0.5% ever develop kidney failure, and if that happens, they get a priority access to transplant. It's important to emphasize, while nothing in life is zero risk, living donation is considered one of the safest major surgeries performed. Donors are generally very healthy to begin with, which contributes to their safety. Important research comparing donors to equally healthy non-donors has generally found no difference in life expectancy or major health outcomes. Donors do as well as anyone, and in fact, because they remain under some medical supervision and tend to maintain healthy lifestyles, they often stay very healthy. We also counsel donors on lifestyle with one kidney to avoid habits that could harm the kidney, like smoking, and avoiding painkillers like anti-inflammatories, and staying well hydrated. Maintaining a healthy weight and diet to avoid diabetes is also very important to avoid stress to the single kidney. It's one thing to talk about statistics, and it's another to hear real stories. I want to share a brief story from my own experience, and then highlight some truly inspiring donors who are actually kidney doctors themselves. So I once had a patient, father of 2, whose kidneys were failing. His wife immediately wanted to donate, but he was very hesitant, and he said to me, "I appreciate her offer, but what if we both end up sick? Who will take care of the kids? And what if something happens to her from the surgery?" This is a common fear. We've had many discussions together with him and his wife and our team about the risks and how we mitigate them. We made sure his wife got all the information and reassurance from our donor team. Remember, the donor has their own team of doctors looking out for their interest, separate from the recipient team. So eventually, with careful consideration, they decided to proceed. The surgery went smoothly. A few months later, they both came to my clinic for a follow-up. Husband with a transplanted kidney kidney working perfectly and the wife fully recovered from her donation. They both looked healthy and perhaps even more importantly, they looked happy. The husband had his energy back, was off dialysis. The wife was relieved that he was healthy again. She told me with a smile, both of our lives are back and thanks to this transplant. It was heartwarming to see that not only did the recipient benefit, but the wife was thriving and joyful because her family's life was improved. They were traveling, enjoying activities that had been on hold. That's when it really struck me. A successful transplant truly can give two people their lives back, the recipient and the donor, who no longer has to see their loved one ill or tied to a machine. Moments like these are some of the most rewarding moments of my career. And this kind of generosity isn't limited to family or friends. We have seen even anonymous donors, complete strangers, step forward to give someone a second chance at life. So don't hesitate to share your story. You never know who might be inspired to help. So two nephrologists, people who spend their lives taking care of kidney patients, have donated their kidneys to strangers on the wait list. One of them that I proudly was taught by was Dr. Bob Richardson, a nephrologist at UHN. And another nephrologist in US from Northwestern University donated her kidney to a complete stranger as part of a kidney pair donation. They didn't do it for recognition, they did it because they deeply understood how transformative a kidney transplant can be. Now, none of this is to pressure anyone. Donation is a personal choice and not everyone is in a position to do it. But for those considering it, they should know that donors usually do very well and lead normal lives with no regrets about donating. The donor well-being is our priority all along. To wrap up this discussion on donor safety, nothing in life is 100% risk-free. Driving a car has risks, giving birth, traveling in an aeroplane, all have risks, yet we do them because of the purpose they serve. Living kidney donation is similar. There are risks, but they are low and well managed, and they come with a profound purpose of saving a life. For the right individuals, it is a risk well worth taking. Our team's job is to minimize those risks at every step and to fully support the donor before, during, and long after donation. We cherish our donors. They are heroes in our eyes. By understanding the facts and hearing the stories, I hope you feel reassured that if you have a potential living donor, they can donate safely.